Hello and welcome to Inside Healthcare. We're coming to you from inside the urgency room at Venice Heights, and we're pleased to have with us Dr. Rob Anderson. Thank you for being with us.
Well, thanks for coming here.
So we're going to be talking about the flu, and we understand from the CDC as well as even the Minnesota Health Department that there is an outbreak right now of the influenza, the 2018 influenza. Maybe we can start by, what are you seeing here at the urgency room?
Well, we're seeing a lot of influenza. The Minnesota Department of Health said it started to spike at the week ending of January 6th. They started to see just huge numbers of influenza going up. Most of it is influenza A. We're seeing a few cases of influenza B, but mainly it's influenza A.
And how does the flu vaccine, is that it contain those strains?
So there was an initial report that came out, I think back in December, said that it wasn't very effective, maybe only 10%. However, that was not a very accurate reporting, and I think the most updated numbers that I saw is it's about 33% effective this year for covering the current strains of influenza.
And it's never too late to get the flu vaccine if you haven't gotten one yet.
Yeah, we'd absolutely recommend getting it. It certainly does help prevent the illness. And sometimes even if you still get influenza, if you've had the vaccine, it helps make the influenza virus not as severe for you as well. So it's certainly even worthwhile now, at the beginning of February, to go ahead and still get the vaccine if you have not gotten it.
And why don't you tell us about the different types of the vaccine that are available? They're not recommending that you get the spray one this year?
That's correct. Yep, so they found the spray one's not very effective this year, but there's a trivalent, quadvalent. Essentially whatever your doctor is recommending or whatever they have is going to be helpful. One of them has 3 of the viruses that it's effective against, the other one has 4. And there's some other vaccines that are out there. Sometimes for the elderly there's one that has a little bit more power, more of the vaccine within it to help boost the immune system even more. But typically if you get any of the influenza vaccines, it does provide some relief and effectiveness against preventing influenza.
And people say, well, I got the vaccine, but I've still got the flu?
Yep. Yeah, so it is still possible. Some people still get the flu. Another misconception that's out there is people often say, I have the flu, but they're actually referring to the stomach flu, which is something different. That's typically caused by a virus. Norovirus is one of the more common ones, and we've actually been seeing an uptick in that as well.
Yeah, I understand there was quite a number of cases across the country of the norovirus as well.
There was, yeah, some type of stomach bug that was causing people to have nausea, vomiting, and diarrhea. So the influenza vaccine does not prevent that because that's a different entity, but people commonly confuse those two and refer to the flu as both of those. One's a stomach flu and the other one is influenza.
So what exactly is the flu?
So the stomach flu is typically caused by the virus, and then influenza is a viral illness. It's an upper respiratory infection. It's kind of like the common cold on steroids, so it's much worse. People come in with horrible body aches, high fever, and it just comes on all of a sudden. People feel so fatigued. They're just, all they want to do is sleep all day, and typically they are, and that's what we recommend for the treatment for it as well, along with a few other things.
So when should they seek emergency medical care?
Yeah, so the CDC, the Minnesota Department of Health, says if you feel like you've come down with influenza, which is going to be the high fever, body aches, just fatigue, that you should generally stay home and self-medicate with Tylenol every 4 hours, ibuprofen every 6 hours. But if you're feeling worse, there are certainly complications of influenza that we worry about. One of the main complications that we worry about is pneumonia. So oftentimes people will come in, they'll feel awful, have that high fever, sleeping all the time, this dry cough, and sometimes people have this productive cough with it as well. So what we do is we like to get a good listen at the lungs to hear if there's any sounds of pneumonia, or if they're abnormal. We check the oxygen number on the finger as well and see if that's low. And if that's low and there's abnormal lung sounds, that's a sign that there could be pneumonia. Then we can get a chest x-ray here to determine if there is pneumonia. And if there is, that requires antibiotics. And antibiotics will cure that bacterial infection. But the treatment for influenza is antiviral, which doesn't cure the virus. It just decreases the severity and the length of symptoms. It also makes you a little bit less contagious, too.
And I understand you have to take it within the first 48 hours?
Yeah, they do recommend within the first 48 hours to start the medication, the antiviral. Sometimes you can take it a little bit after that if you're immunocompromised, if you're undergoing chemotherapy, if you've had a kidney transplant and you're on anti-rejection medications, if you have COPD, asthma, other pulmonary or neurologic conditions, sometimes it will still start up. But yeah, the effectiveness of the antiviral is the sooner you start it, the better. So even within the first 12 or 24 hours, somebody came in the other day, they're just hit by a bus, they felt like. Just fatigued, just wanted to sleep, high fever, and they came in within 12 hours. So we're able to start them on that medication in hopes it'll help decrease the severity and length of their symptoms.
And then did I hear that there's also like a shortage of the IVs as well? So I mean, that's a concern.
Yeah, so the saline bags for people who become very dehydrated, there's a shortage of those bags. Are actually made down in Puerto Rico mainly, so there's been a shortage of those, and we're trying to get some other supplies into the U.S. from other countries as well, but there is a little bit of shortage of fluid, so we're trying to be respectful of that and provide IV fluids for those who need them, and certainly we still have that available.
And people don't need to be concerned that there is help available if they need it and stuff.
Yep.
So the flu vaccine, I understand, is really recommended for just about everyone of all
That's
ages,
correct. Yep.
right?
Yep.
And even as young as how old?
About 6 months or so.
6 months. And now do they need just one shot?
They need two. From age 6 months to about 8 years, you need to have two of the vaccines in order to provide full immunity.
Okay. And then as far as like people, the flu comes around every year, and people think it's just the flu, or I've never gotten the flu, so I don't need the vaccine.
Yeah, and every year, the influenza outbreaks, it's different. We remember back to 2014-15 was a really bad influenza year.
Absolutely, I remember
And this
that.
year, the 2017-18 year is looking to be on track to be similar to the 14-15 year. So it is going to be a little bit worse year this year. So we certainly recommend still getting the influenza vaccine if people haven't gotten it. And if you have any concern about your illness, certainly see your healthcare provider. If you come into the urgency room, we'd be happy to see you as well.
Okay, sounds good. And then other viruses and stuff, you mentioned the neurovirus, other things that you're seeing here?
Yeah, I mean, we're always seeing the common cold, stuffy nose, runny nose. The great majority of the time, that's a virus. Sometimes if there's ear pain and a fever with it, there's ear infections. We're still seeing strep throat. We're seeing a lot of croup as well. Still, that's certainly quite prevalent too. A few cases of hand, foot, and mouth, but not as much.
Hand, foot, and mouth? What is that exactly?
Just another viral illness. It causes lesions on the palms of the hands, the soles of the feet, and in the mouth as well. I should also comment that there's another big infection is RSV, bronchiolitis.
Absolutely.
That's another viral infection that affects kids of all age and even adults too, but we really worry about it more in the population 2 and under. And even in the first few months of life, those are the kids that we really worry about. This is a virus that causes a lot more mucus production, a lot more kind of runny nose, snotty nose, coughing a lot. And what happens with the younger kids is that they just don't have as much surface area in the lungs to exchange that oxygen. So you get a little bit more mucus in there, and that causes their oxygen number to go down a little bit. And the treatment for this, again, it's a viral illness, so the treatment is more supportive. So if that oxygen number begins to go lower than 91 or 90%, then we like to keep kids in the hospital and just give them a little bit of oxygen to breathe to help bring their oxygen numbers up.
And it seems like that seems to hit later in the, early spring or something. There are a lot of cases of that.
We can see it in the early spring as well, but we're even seeing some of it now too.
Yeah.
Yeah.
So, and the flu can be deadly. I think we've heard that there's more than a dozen of children that have died nationwide already.
Yeah, it's pretty sad to hear, and it goes to show the importance of getting the vaccine to help prevent that. And if you are having concern, if your child is not breathing well, if they're breathing fast, if they have retractions, which is when you lift up their shirt, if you see their ribs with each breath, if you can see their ribs kind of stick out, that's a sign of them not breathing well. It's certainly a sign that you should get in to see a pediatrician or go into healthcare facilities such as emergency department or urgent care or here at the urgency room as well.
And the vaccine is the best way to prevent getting the flu.
It is, and then also just our common practices
Yes.
of always wearing a mask, washing your hands a lot. If you do have a cough and high fever, certainly try to cough in your sleeve, try to stay away from other people. I had influenza a couple of years ago, and I stayed home from work, and I locked myself pretty much in the basement so I wouldn't get my son and my wife, who was pregnant at the time with their second child, sick. And I wore a mask whenever I was around them, and fortunately they did not get it.
Any other things that our viewers should be concerned about and be aware of, and to take it seriously, that we are
absolutely.
in the height of the
Absolutely.
flu season right now? And
Yeah, I always tell people, trust your gut, with yourself or with your kids. If you feel that there's something worse going on, then absolutely please seek help. There's lots of great medicines that are out there that can be helpful. When you start to have that high fever, take Tylenol every 4 hours, ibuprofen every 6 hours, dosing according to the box, and drink plenty of water, get plenty of sleep.
And it seems like parents are aware, do not give your children aspirin and stuff, for a risk of Rye's syndrome and that.
Yep, that's a great point.
Any final words for our viewers?
Yeah, still enjoy the season. Get out there with your friends, family. Cover your cough if you haven't. Wash your hands. If you get that high fever, you aren't feeling well, it's probably better to stay home from work and school so you don't spread it to other people.
And get plenty of sleep too.
Mm-hmm.
That builds that immune system inside our bodies.
Yeah, it gives your body a chance to rejuvenate.
Absolutely.
Yeah.
Well, Dr. Anderson, always a pleasure to have you with us on Inside Healthcare.
Well, thank you, Jodi. Thanks for coming to our facility here in Vadnais.
Yeah, thank you. And we'll be back with more on Inside Healthcare.
You're going to need me. You're going to need us. All of us. You're going to need our help with your water, your air, your food. You're going to need our determination, our compassion. You're going to need the next generation of leaders to face the challenges the future will bring. And we promise we'll be there when you need us.
Welcome back to Inside Healthcare. February is known as American Heart Month, and it brings awareness to heart disease and how to prevent this #1 killer of both men and women. And we're very pleased to have back with us Dr. Les Forgosh with HealthEast Heart Care. So thank you for being with us. It's been a few years, so thank you. And I know you're very busy, so we really appreciate your time.
Oh, thank you. Thank you for inviting me, and it's always a pleasure to come back and talk with you and be interviewed.
So how do you know if you have heart disease?
That's actually a good question. A lot of people who are out there may have heart disease and are not aware of it, but usually if you have heart disease, you'll have the symptoms of chest discomfort, you may have some shortness of breath, you might have some generalized fatigue. I have this little saying that I like to say to people, for particularly women, because women don't have the classic chest discomfort, anything between lips and hips. Anything between lips and hips that bothers you, if there may be a discomfort in there, a stabbing sensation, a muscle pull, there's a shortness of breath, abdominal discomfort, indigestion, could be a sign of heart disease. But like I said, a lot of people, maybe not a lot, less than half would be what we call asymptomatic, where they don't have the classic shortness of breath, the chest discomfort. They might be slowing down. They might not be as able to shovel the driveway as quickly as they did last year. They too could have heart disease and would need us to go ahead and look into that.
You know, and during this flu season too, I mean, chest discomfort could be a very common thing if you've got congestion and things like that. So it's hard to tell the difference, I would think, between what is abnormal or what is just, symptoms of the flu or something like that.
Very accurate observation that sometimes people, they go to a doctor, they say, I'm short of breath, they get a chest x-ray. Well, maybe you have a pneumonia, maybe you have the flu, whatnot. Doesn't clear up after antibiotics, after weeks, after maybe some Tamiflu. They end up coming back to an urgent care. Somebody checks a blood test and says, oh, goodness gracious, your lungs are full of fluid. Or, oh, goodness gracious, you're in heart failure. Then they get sent to the hospital. We do an ultrasound of their heart muscle, find out their heart muscle is functioning maybe at 10, 20%. This has not been the flu, this has not been pneumonia, but this has actually been heart failure or systolic dysfunction, we call, when the heart doesn't squeeze well.
Are there other symptoms that people should be looking for that might say, I should go in, and when should they go seek emergency care, I guess would be another good question.
Well, the first part, anything for the most part out of the norm, like I mentioned, fatigue, considering chest discomfort, shortness of breath would be great. And I use the word discomfort. It's not the classic pain. If you remember, I think it was the Jeffersons.
Yes.
I'm coming. So chest discomfort. But no, it could be any sort of thing inside. I look for swelling of the legs, sometimes some fluid in the legs, lower ankles, maybe some abdominal bloating. These can all be clues. Now, when to get urgent care, certainly if somebody all of a sudden is feeling great and then they have a blackout spell or shortness of breath comes up out of the blue, or they all of a sudden get that discomfort in the chest, that would be concerning. They probably want to seek urgent care right away. Other symptoms that might have been percolating for a few weeks or a month or so, those would be reasonable. See a primary care provider, discuss them, maybe then further testing, heart tracing, EKG, ultrasound of the heart, maybe some blood work, stress testing that could possibly help us look for underlying heart disease.
Are there certain individuals that are more at risk for heart disease?
Risk factors for heart disease. Some of the risk factors would be, number one, family history. Mother, father dying or having a heart attack or open heart surgery at a relatively young age, 60, 65, 70 would make one think. Typical risk factor panel, diabetics, especially diabetics taking insulin, those with high blood pressure for years, cigarette smokers, and once again implore, please, if smoking is in there, kind of stop smoking if possible, although it's difficult to do. High cholesterol, certainly if somebody has relatively high cholesterol, that would be concerning for the development of heart disease. Those are some of the big ones, I would think so, they're at risk.
Important to know those numbers, like your cholesterol, your blood pressure,
Correct.
and things like that.
Correct.
What should, and I know that there was just a change in the standard for high blood pressure. And what is it, and what does that mean?
We're making it difficult for people. It used to be 140 over 90 was good, and even before that, I want to say it was FDR, whose blood pressure was 200 over 100. It was known to be relatively high, of course, strokes involved there. But now we've lowered it to 130 over 80. So 130 over 80 is called pre-hypertension. So really, a pressure of 120 over 70, 110 over 60, those are numbers we want to see. 120s, 130s, but certainly you start getting up to 140s, 150s, top number, 90s, 100s, bottom number. Those are numbers we don't want to see, and we definitely will want to start medication to get those pressures down.
I was going to say medication is probably the best way. Is there other ways that you can reduce that high blood pressure?
I always start with lifestyle modification. If you're drinking 2 drinks a day, cut it down to 1. If you're not exercising, try to walk a little bit more.
So alcohol can elevate?
Alcohol can raise blood pressure. Okay. Salt restriction. Rather than having the salted fries from the fast food, try the unsalted fries. Anything we do, lifestyle modification, stress reduction, easier said than done. If I had a solution to reducing stress, I'd be a rich man, but trying to reduce one's stress would be helpful, maybe even some meditation. Those kind of, stop smoking, those kind of lifestyle modifications, if those don't work, then we need to start looking at blood pressure medications, of which is over 80, 90 on the U.S. market right now.
And what about cholesterol? You said that could also be a risk factor.
Right. Cholesterol is certainly a risk factor, and before we started, you mentioned President Trump's cholesterol. It used to be we would try diet first. If you primary prevention, diet, try to get your cholesterol total under maybe 200 or so. If you've had a heart attack, then we would try to definitely get it under 200, the bad cholesterol under 70. A few years ago, one of our panels came out and said, forget numbers. If you've had a heart attack, just go high-dose statin therapy. High-dose atorvastatin 80 milligrams, rosuvastatin 40 milligrams, the top dose of those medicines. Now we're actually involved in a lot of research. We're showing, well, no, that's not good enough. Lower is in fact better, and the pendulum's switching back over to where we want to try to get the total cholesterol down the best we can. If you've never had a heart attack before and you're at risk, certainly under 200 would be great.
And that's total cholesterol, or is that the LDL?
That would be the total cholesterol, the bad cholesterol, LDL, ideally under 100.
HDL?
HDL, we'd love to see I personally love to see it above 35. Computer will say they'll just see it above 40. I don't like it in the 20s. Raising HDL is a difficult thing. That's usually genetic. Exercise will help bring it up.
I was going to ask that question.
Exercise can help bring it up. And even though I said wine can raise your blood pressure, red wine maybe might help raise the HDL, but unfortunately it's usually exercise and getting the bad cholesterol, the LDL, down.
And exercise, any formula that people should, twice a week, 3 times a week?
Aerobic exercise,
Aerobic
definitely.
exercise.
I usually like to say 3 to 4 times a week. preferably 20 to 30 minutes each time, a period when they increase their heart rate, whether that's with a bicycle, swimming, walking, running, treadmill, some form of aerobic where they're moving and increasing their heartbeat.
And you mentioned research that there is some current research going on about some of the medications and things?
The standard medications are statins. People have heard of it, atorvastatin, rosuvastatin, simvastatin. There's 7 out on the U.S. market now.
I had no idea. I just knew that there were statins.
They're the big ones. And we use them. They've been shown to prevent heart attacks once you've had heart disease or a blockage. And a lot of people you might have heard get muscle aches and pains, and they can't tolerate the medications, and they only bring them down to a certain level. So now there's all these alternatives, and these are pills essentially you take once a day. Now, believe it or not, there is an injection where you can take once every 2 to 4 weeks in your abdomen. You give it yourself. That lowers cholesterol to levels never seen before. We are now working on research out at HealthEast where there's an injection once every 6 months. An injection once every 6 months lowers cholesterol. That's a study we're running. There are some other studies we're running where we're looking at alternative pills to the statins. Very similar every day, and they lower cholesterols, but they don't cause the muscle aches and pains that people have been getting.
So how does someone know if they're a candidate to participate in the research?
Unfortunately, the research studies right now are looking at people who have had heart attacks or heart disease, and they've been on a statin therapy, like I mentioned before. So certainly they could contact us and we could consider them, but it's not for somebody who's not had any heart disease or, for instance, doesn't have that high of cholesterol.
What else should other people know about heart disease and preventing it?
Okay. Touched on definitely stopping smoking if they could, keeping blood pressure under good control, whether it's with lifestyle modification or medications would be great. Diabetes, certainly see your primary care provider and try to get those sugars down as much as possible. Regular aerobic exercise, whether it's swimming, biking, whatnot. If there's any question, by all means, see a provider for maybe at least a heart tracing, electrocardiogram, possibly an ultrasound of the heart. Any questions of fatigue, shortness of breath, discomfort, even abdominal bloating, see a provider. I think that would be a good thing. Cholesterol, watching what you eat. I always tell my patients, if it's bad, it's good. If it's good, it's bad. So if it looks good, that baked potato with cheese or whipped cream or sour cream, it's going to be bad for you. Wipe off all the sour cream and whatnot. Plain old baked potato, it's not as good, but it's better for you.
Mm-hmm. And other things that they should avoid, high-fat foods, or
by all means. Yeah.
And some of the red meat, maybe even as well, or
red meat probably once or twice a week's not bad. Certainly having a cheeseburger or a steak and cheese sub every night is not a good idea. Fresh fruits, fresh vegetables we try to push. Fish we try to push. Certainly high cholesterol food, baked products, things we'd love. The bag of chips, maybe not the best thing to do.
Or use alternatives.
Correct.
I don't know if baked potato, potato chips that are baked are better than the ones that are fried and stuff.
Absolutely right. Slightly better, but once again, if it tastes good, it's bad. So, geez, a rice cake doesn't taste quite as good, but it's probably better for you than a bag of salted vinegar potato chips.
So if someone would like to see a cardiologist, they should be referred by their primary, or?
Correct,
Okay.
correct. I'm sure they could make an appointment, but just we're our referral-based practice, and we appreciate involving the primary care provider in any decisions or treatments we might be performing. So it'd be good to get them involved and have them referred to us.
And final comments.
Heart Disease Month, yes, #1 killer. We can do what we can by trying to prevent it out there. Any questions, by all means, speak to your primary care provider, but please address your risk factors, and I think we should be good with that.
Well, Dr. Forgosh, it's been a pleasure to have you back with us, so thank you.
Thank you. It's good to be here.
Great information, absolutely. So thank you.
Thanks.
And finally, we thought that you would like to know about a very special local program where breast cancer survivors are inspiring and helping newly diagnosed breast cancer patients. It's called Firefly Sisterhood. Take a look.
Next time, okay. Go ahead, your turn. I was 34. My older daughter was 3, and my youngest was just about 7 months. Okay, Marin's gonna go first. I found a lump, and They wanted to proceed with a biopsy right away, and then a couple days later I got a phone call and found out that, yep, I sure did, had breast cancer. You know, the message to her when I was diagnosed was that Mommy is sick, I have cancer, but the doctors are going to help me get better. I had a lot of great support from friends and family too. They really rallied, and that made all the difference in the world. I'm still incredibly grateful. I think that it helped me to take this experience that I had and do something good with it. You know, I want to provide support to let, you know, in general, these young moms know that it's going to be okay. You know, this is something that you can get through, and I understand what you're worrying about and a lot of times what you're feeling through this process.
I think we were matched well in that way, so then we could kind of talk through like, oh, well, how do you tell your kids when they're this age, or how do you, deal with when they ask you why you're sick. She's just like my special angel, that just kind of knows what happened, how you feel, how it is to be, like a working mom and going through a scare like that.
I get out of the Firefly Sisterhood that I didn't realize. I mean, I thought I was going to be giving back, but I'm getting so much as a survivor because I have the opportunity to process still my journey, and it's something that I didn't really know that I needed to do until it started to happen. Kind of a way for us all to heal and to take, this negative experience and do something really good with it, be a part of something really good. All right, bye, Mindy.
Since the Firefly Sisterhood program started about 4 years ago, it has already helped more than 500 local breast cancer patients. For more information, go to their website at fireflysisterhood.org. Well, that's our program. We thank you for joining us. We hope you join us again next time on Inside Healthcare. See you then, everyone.